I talked to a lot of people, I read a lot of papers, and I gingerly started doing some of the techniques myself, and I learned a lot through my own mistakes and trial and error.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. Hey CPD Junkie podcast fam, I'm your host Laurence Doan, and today we're joined by Bez Shokouhi. He attained his BDS with first class honours in 2006 from King's College London. He's a member of the Faculty of Dental Surgeons and the Joint Dental Faculties of the Royal College of Surgeons of England. He has also completed 2 further university degrees, the King's College London Postgraduate Diploma in Aesthetic Dentistry and the University of Sydney Graduate Diploma in Dental Implants, plus a ridiculous number of other courses and seminars. Bez is passionate about dentistry and is an ever learner, a tinker and experimenter by nature, and as such he finds himself constantly innovating ways to tweak and improve his dentistry. He practices the full gamut of dentistry, including complex restorative aesthetic dentistry, orthodontics, oral surgery, and dental implants. Dr. Bez Shokouhi, welcome to the show.
Thanks very much. Glad to be here.
So tell us about your CPD journey so far.
Right. So, as you mentioned, I qualified in 2006. That was back in the UK. In the UK, when you first qualify, you spent 1 year over there doing something vocational training, which is when you work in practice under mentorship. I think currently now actually that's increased to 2 years. So I did that, which was a nice little intro to working in practice. After I came out of that, I spent several years working in the hospital system there, doing jobs over there that are called senior house officer jobs or SHO jobs. It's kind of analogous to the dental jobs in public hospitals here. But in the UK, the pathway for that is much more developed. So I spend time in various emergency or medicine and or surgery departments. So I did that for a few years. I even spent 1 year working as an oral and maxillofacial senior house officer job at Ipswich Hospital, which was a very interesting experience, very valuable for surgical skills and wisdom tooth extractions, amongst other things that I certainly won't be doing again. Once I came out of that, that's when I moved to Australia. And in Australia, I went into private practice straight away and started on a journey of doing lots more CPD over here. So as you mentioned, the 2 big ones that I've done are the university degrees, which are King's College Hospital Graduate Diploma in Aesthetic Dentistry. That was in 2013 to 14. And then I did the Sydney Uni Graduate Implants, and that was 2016 to 17. And apart from those, lots of other hands-on courses. Basically, I guess you name it, but whatever this discipline, I've done it, in composites, soft tissue, grafting, endodontics, periodontics, lasers, CEREC, oral surgery, wisdom tooth extractions.
Yeah.
And I'm sure I'm missing quite a few there, but I think I better stop there.
Yeah, look, I mean, let's bring it back a little bit. Was there a particular reason why when you graduated, you wanted to go down that path of getting to the house officer kind of role? Because like you mentioned, you were doing a bit of restorative and pediatric dentistry at that time, and then you switched to OMFS, but then you kind of came back to pediatric dentistry a little bit, right?
The pediatric dentistry that I did, that was one particular period, which was very valuable. It's great to learn how to work with kids. But is your question, why did I kind of do all these jobs in the hospital system?
Yeah.
Because it was a very good experience. I wanted to experience different departments and be exposed to all sorts of different things. I guess, at the time also I was realizing where my interests lay. I wanted to know whether I'm going to go broadly into a surgical direction or into a restorative direction. So those initial years really helped me understand, I guess, within myself that I primarily see myself as a restorative dentist who also enjoys surgical aspects. And also, if I'm honest with you, I don't know how much you know about the UK system, but over there, obviously, we've got the National Health Service, the NHS system. And, as great as the NHS is, I wasn't all that keen to work in NHS dental practice.
Yes.
Because the NHS dental practices, they've got their own issues over there. So
Yes.
I was happy to work in a hospital system there and then come to Australia.
Fair enough. I mean, because when I hear colleagues go into the hospital in Australia, they're thinking they want to specialize. Like, we've got oral maxillofacial surgery rotations, like you can become the house officer for that. And so people are signing up for that here because they're thinking, maybe I want to specialize in the future in this area. Was that something that was also on your mind at the time?
So thoughts of specialization definitely went through my head, and I'll kind of tell you how that came about and where that led to. But I guess in the UK, like I said, these hospital jobs or the SHO jobs, they're very common. The way I understand it, even now, is there are many more positions and pathways in the UK, and there are many more hospitals that do these jobs than there are in Australia. So it's very normal for you to go and do one of these jobs to gain more experience, even if you're not thinking about becoming a specialist.
Right.
So, lots of people go and do, a year in Max Fax, but then that doesn't necessarily mean they want to qualify as a Max Fax. So it's not just me. A lot of my friends did a year in Max Fax, and it's just really good experience.
Interesting.
Now, why? I certainly thought about and considered and contemplated becoming a specialist for those early years of my career, and the one that I really considered was prosthodontics. And for a while, I thought I'm going to go and study to become a prosthodontist. The more I kind of did various things and more experience in various things, to be honest, I kind of realized I like everything. I enjoy everything. And I realized I would almost be doing myself a disservice by getting into a particular specialization, because I wanted to do that, but I also wanted to do orthodontics, and I also wanted to do oral surgery. I enjoy doing wisdom tooth extractions. I even enjoy doing checkups and cleans. I derive pleasure and clinical satisfaction from doing even the basic stuff. So I didn't want to hole myself in, but rather be a general practitioner and make myself the best version of that as I can and keep on improving. So that's where that led me to.
Can you explain a little bit about the Faculty of Dental Surgeons, or the Joint Dental Faculties of the Royal College of Surgeons? Is that similar to like our primaries over here? Is that what it's like?
The way I understand it, I can't say for certain because I haven't done the primaries over here, but yes, I think it's something similar. So obviously you've got the Royal College of Surgeons over there, and they have basically you had to study a lot and take these exams which came in different parts, and there was written stuff, and there was some clinical stuff, and by the end of it you got these you passed and you got these memberships. I don't know exactly how the Australian version is. I know there's part 1 and part 2, and I know a lot of people have done part 1 but not necessarily part 2, so I think maybe you might have to fill me up in that. I don't know.
Yeah, it would be similar, something like that. You do a written exam on it, and then you have the orals, like the case presentations where they talk through the cases as well with you as well. Yeah. Exactly
right. Yeah. So I think they're very similar and quite analogous to each other.
So, okay, so you're working in London right now, and then at some point you decide to come to Sydney. And when you start working in Sydney, I assume it's because, is this because you've met someone at some point?
Not at the beginning.
Yeah.
That comes a bit later. But no, I came to Australia. So back in 2000, I qualified 2006, and back in 2005, me and my very good friend Anand, we came to Australia, and this was as part of our dental course, because in the UK, you do this thing in your final year of uni when it's called the electives. And basically, dental students are encouraged to go on some kind of a trip. It could be domestic, but most people go international somewhere, dentistry related. And, that could be 90% dentistry related or 5% dentistry related.
Yeah.
But, you mix and match. So myself and my friend, we decided to come to Australia, and we went to Broken Hill. And we spent a good bit of time with the Royal Flying Doctors, which was an amazing experience. That was actually my first experience of Australia. Even before I saw Sydney or any other coastal cities, I saw Broken Hill and the outback with red sand.
Yeah, I was gonna say.
So that was amazing. After that, we came to Sydney and spent some time over there, and I was blown away for a Brit to come to Australia during the summer and come to Sydney or any other coastal cities. It's mind blowing, especially since it was January and it's all freezing cold and raining all the time over there.
Yeah.
So when I went back to the UK, I kind of thought, why am I doing this to myself? I'm going to think about going to Australia at some point. And literally, I started planning and scheming and got a permanent residency sorted out. And I came in 2011. Wow. And that's over 10 years ago, and I've been here since. And yes, I did meet someone. And married with a couple of kids now. So it's all worked out well.
Yeah. So tell me, like, when you're graduating as well, I mean, how do you kind of picture doing your CPD? Are you kind of planning it, or are you just kind of doing it bits and pieces everywhere?
If I told you I had a master plan all written down of what to do in what order, that would be a complete lie. Especially in those early years, like I said, in my UK times, before I came to Australia, it was very much focused on, different experiences in different hospitals, and just feeling my way through dentistry. I think that's the easiest way to describe it. But then when I came to Australia and I went to private practice here, gradually, I started sort of understanding more my own interests and what I want to do, and doing more and more courses. I think I wanted to have a very broad base, and that's why as we listed all the different things that I've done, there's such a variety there. I haven't focused in one area, but really I wanted to be a general practitioner who did pretty much everything.
Yeah, I mean, because a lot of graduates when they
Sorry, go on.
No, I was going to say, a lot of graduates, when they graduate, they want to learn implants or ortho very quickly, right? So, I mean, what would you say to that?
It's a good one, isn't it? Because that's not what I did. I actually spent quite a lot of years doing other things and gaining general experience. I think by the time I did, say, implants, I was already a good restorative dentist. I really felt solid in what I was doing. And I think that foundation really helped me. That's not to say you shouldn't do implants early on. I think, different things might help different people in different ways. For me, when I did implants and I really had that, strong grounding in restorative dentistry and surgery, I was already doing a lot of wisdom tooth extractions. It was very valuable to me. So it made it a lot easier for me.
So let's come back to that then, the restorative aspect. How did you try to level up and get better at the restorative side?
Okay, so I think the King's aesthetic dentistry that I did, that was great. So that's a blended program, they call it. So there's hands-on elements to it, and then there's online distance learning elements to it as well.
Mm-hmm.
I'd probably describe that course as the course that really consolidated and solidified my learning. So I already knew a lot of things and had done a lot of things, but there was a bit here and a bit there and a bit there, and it was quite, there were holes in my knowledge.
Mm-hmm.
And that was a course that filled the holes and made the whole thing really part of the whole.
Mm-hmm.
People often ask me sort of in that program, did you, what brand new skills you learned? And the truth of it is, there probably weren't that many brand new things. Maybe for some of the other delegates there were, but for me, I'd already kind of knew them and had done them, but not in a very unified, proper way, whereas that really made it proper for me.
Yeah, right. And with that one, this is how do I describe it? So yeah, how did you come across finding it? Because people say that sometimes they talk to other colleagues and that's how they come across it, or because you were from, London, you already had prior knowledge. This was kind of something that you were seeing.
I'm from London and I'm from Kings.
Yeah.
So the main person who runs the program, I don't know if he still runs it, he might, is Professor Brian Miller. And Professor Brian Miller was actually, in his pre-professor days, so at the time he was just Dr. Miller, he was the guy that actually was in Phantom Head teaching me how to do dentistry. So I knew him, I trusted him, so when he came up with his program, I went in and did it. And I knew various other people who taught on the program as well, like Dr. Sabir Banerjee. So yeah, for me, I didn't stumble across it by accident. I already knew these people and I knew their capabilities.
Wow. See, wow. Okay. I'll openly admit that I actually started the King's College fix and removal prosthodontics back 2 years ago.
Okay.
And yeah, Prof Miller teaches that now. And to what you said,
right.
He doesn't focus as much on the aesthetic side now. He's got someone else doing that. But to your point, wow, to know that you knew Prof Miller before he was Prof and he was the clinical tutor.
Do you still talk to him? If you do say hello to him from me.
I definitely will. I'll be returning back next year, so I'll definitely say hi.
Right.
So when you're kind of going through that program, you've completed that program, right? Where to from there? Like, are you picked this program? Is this because the practice and the clientele that you're seeing, that's the reason why you've picked this particular program, or it was something of an interest to you that you decided that you want to pick this program?
It was something that was of an interest to me, and I felt like it was a suitable program, I guess, to push me to the next level. As a clinician growing, I saw it as a valuable next step in my growth as a dentist. University, examined program, I'm sure you understand as well. It's different to doing a 1 or 2 day course, non-examined, or anything non-examined. When something's examined, you don't have a choice, mate. You got to learn. You got to put the hard work in. You got to put your head down. You got to do the assignments. You're not automatically passed. It's hard work. It is very, very hard work, and a lot of hours and grief and tears went into my 2 different university programs, but I'm very, very glad that I've done them.
Some of the things, when I look at your work, I'm seeing like the sausage, the earthworm technique with the lower anteriors, the verti preps, or the on laser, all of that. Talk to me about when, as a recent grad looking on, how you kind of progressed in your learning into that area.
I'm how do you get to doing all these things, right? I love dentistry. I can't stress that enough. Like it's my passion. I'm a geek about dentistry. Um, there's this running joke with my wife that every single time she looks over my shoulder into my laptop, there's some teeth or something on a screen. I go to bed thinking about dentistry and teeth. It's always in my head.
It runs in your veins.
So it's my it's my natural. It runs in my veins. It's my natural passion. I eat, drink, sleep dentistry. So, okay, social media has actually been very useful to me. Facebook, when, through Facebook, I know it sounds very cliche to say, but I've learned a hell of a lot through it, the University of Facebook. The trick is seeing through the BS and recognizing what's good and carefully trying out some of the techniques on there. Now, how did I start doing various techniques like sausage technique and so on? I think the sausage technique I first saw Lincoln Harris doing it. And I thought, okay, this looks like a good idea. I'm going to give it a try. And I documented it and I did it again and again and again. And I became better and better at it. And I now think it's a useful technique and it's got its place. Verdi preps, there's, nobody taught that to me. I looked at so many different online sources. The late Massimo Mazza, he was great. He's got a website that he's got a lot of valuable videos on there. So I looked at his stuff. I talked to a lot of people. I read a lot of papers, and I gingerly started doing some of the techniques myself. And I learned a lot through my own mistakes and trial and error. I've got this drive, I guess, to do these kind of things. And if I see something that makes sense and is a good idea, I want to learn it and I want to know how to do it.
And I like the fact that when you say you learn it, you don't just, like you said, you go and read more about it and try to really all consume it and also talk to other people to really kind of wrap your head around it, as opposed to just being like, okay, I see this right now, I'm just going to go and try it tomorrow.
I do all these things, but there's a lot of thought and pre-planning that's got into it before I do it. Say the sausage technique. I kind of read about it as much as I could, looked at the pictures and tried to understand the descriptions. The Verdi prep was a much bigger journey. So, because I knew I'm kind of going into this sort of an area that not a lot of people do it. So for that, I really read all the papers on BOPT and everything from Tomorrow Tooth and all the various people that do it, and to try to really understand why this technique works and how to do it better. And I've even tinkered with some of the protocols myself, I guess. But yeah, no, exactly right. If I go into doing a technique, I don't just do it, cowboy way. I'm one to really try to understand something before I delve into it. The same was with implants. I refused to touch implants until I had a super solid learning and background into them. And that's why I wanted to go and do a proper university degree to learn how to do them.
Yeah, and how did you find that university degree? Because you just... I don't know, this is intense. When I was trying to learn about you, you had just finished your Kings, and then the following year, or that same year, you started the implant one at the end of it. Is that right?
Pretty much. There wasn't much break in between. By the way, there are no more university programs. I'm done with those. I've got busy life and 2 kids now. So I say, the first one that I didn't have kids, but the second one I just had a baby, so it was very difficult, and my wife was very supportive and unbelievably fantastic to let me go through this course. I think I'm forgetting your question. What did you ask me, Lawrence?
Oh, just like, how did you find the course? I mean,
how did I find it?
Yeah.
You mean how did I discover it?
No, just as in like going through it during
How was it?
your experience. It.
So the implant course, Sydney Uni, fantastic. Like, if you want a solid understanding from almost A to Z in implants, you can't go wrong. You can't do better than a proper university degree. I'm biased, I understand that, but I'm not afraid to say it either at the same time. The course was very well organized, and it was just as a so before I started. Dr. Ivan Kleinberg was the course director for many years. In the year that I started, he's now Dr. Kent Ewan, and Kent is a super guy, unbelievably knowledgeable. I think I should say associate professor actually. Look, it was incredible to get exposed to like pretty much all the specialists, all the big names in implant dentistry in Sydney. Extremely hard work. So if you're doing it, prepare for the pain. But you will learn implants very well. And the incredible thing also is you're not restricted to learning about one or two implant systems because it's a sponsored course. You learn about implants in general. You learn about all implants, design features, etc. So you have days dedicated where Noble and Straman and Southern Implants and Astra come and present their stuff to you and talk to you, but you're certainly not locked into learning just about their systems. And that for me was very valuable.
So amongst all of this, and that's all happening, right? You've got the aesthetic, and then you're doing the implant. How does orthodontics and endodontics, all of that kind of come into the picture?
Well, the endodontics is a necessity, isn't it? As a general dentist, you've got to do endo. So if I'm doing endo, I want to do it well. So I did endo courses. Orthodontics, I don't do fixed appliances. I haven't done a very comprehensive orthodontics course, say one of the bigger courses. What I have done is Invisalign, I think it's a great system that works well in my hands. There are various clear aligner systems out there. I'm sure they all work well. I'm used to Invisalign, so that's what I use. But to me, the more you get into dentistry and restorative dentistry, you realize you can't run away from orthodontics. You can't escape it. You need it. It's absolutely crucial the more you do dentistry and the more you do bigger cases. So, I wanted to learn about it. I wanted to be able to do it myself and incorporate it into my own practice. Orthodontists are amazing specialists and they do magical work out there. On the other hand, I quite like I'm a bit of a control freak, Laurence. I like having direct control in a lot of things myself. So when you can plan the orthodontics and the restorative work that comes afterward together, it's very powerful and it's very useful. So that's why I did the orthodontics again, because I'm doing all this restorative stuff, but I wanted to incorporate orthodontics because it's just needed. Hope that makes sense.
Yeah. They're complementing skills to have.
Yeah.
So then how does CEREC and the lasers kind of come in?
Working in practices that did CEREC. Right. It's very cool technology. It's not absolutely necessary. If you don't have CEREC, you can still do good work. You just send the work out to a good technician and you get the same stuff back. CEREC, if anything, you've got to do more work yourself because you've got to do more hands-on things. But certainly it opens up doors and possibilities of same-day stuff, which is useful. So there's quite a draw for patients for that when you can do same-day stuff. And being able to say, provisionalize teeth on the same day. There are some really useful things you can do with CEREC that you can't do otherwise unless you have an on-site technician to do the same things for you straight away. Lasers actually has been a very small part of my practice. So I've only used lasers for a short period of time, and so I actually don't have that much experience with them. I've been on a course with them, but it's not been a big part of what I do. I do have an electrosurgery unit, and I love it. I think it's very useful, and I work it often. Every week I'm using it several times a week, but not lasers.
Mm-hmm. Yeah. So I guess what I'm trying to get at is, like, you've got these big courses that you're doing, but you've got so many other small, I wouldn't say small, but other aspects of dentistry that you're also trying to master all at the same time. How do you do it?
It's a bit overwhelming, isn't it? I don't know, Lawrence. I just like it all. I don't want to be limited. I want to break out and do everything. So look, I've got no master plan. I'm just trying to be the best dentist that I can be,
Yeah.
And I get, probably for the past year, my new toy or sort of new thing that I'm learning has actually been 3D printers. So that's the next interesting that I'm finding. So I actually bought myself a 3D printer. So
wow,
I've gone out and taught myself how to do my own digital wax ups. So these days I don't send my wax ups out for traditional wax or digital wax ups. I actually do my wax ups myself. I 3D print them. There's some very cool stuff out there, and I'm just always fascinated by technology. So
yeah,
I delve in. I mean, it took me months and months and months before I went and bought my 3D printer. I was just on forums reading and learning, and then I was like, okay, do you know what? I'm going to buy one. It's time. Let's do it. And there you go. Technology is great. I love technology.
Yeah, I mean, look, as someone who's trying to understand you, because I ask these questions because, in the one I'm thinking is, like, you've got these big courses and they're taking a lot of your time because it's very consuming. To fit in all these other aspects, like, I'm just amazed. I just want to say, like, I just don't know how you fit it in. That's all.
That's very kind. I guess the two big uni stuff, they're finished and they're done. So, how I said, dentistry is always here somewhere. So I got to feed it. I got to put other things in there to satisfy that hunger, I guess.
Mm-hmm.
So I mean, if anything, what competes for my time more than anything else are my kids. So when you got a 6 and a 4-year-old, that takes up a lot of your time. So if anything, dentistry has taken a step back, and I don't know what I'd be doing if I didn't have kids right now. Let's just say that.
Are you telling me Peppa Pig is your main priority right now? And the Wiggles?
I probably should update those. Those were when they were a bit younger than that. But yeah, look, there's a lot of I take parenting and being a good dad very seriously. So as much as I keep talking about dentistry, there's nothing more important than being a good dad.
Yeah, well, how do you juggle, being a super dentist, husband and father amongst all of that?
I don't know about it being a super dentist. I just consider myself a reasonably good one, but thank you. I fit a lot of stuff in the evenings, to be honest. So I carry a fair bit of work home with me. There's quite a bit of sitting down behind my laptop and planning cases, doing Invisalign clean checks, doing wax up, just thinking and tinkering and figuring things out, how to do things better. there's still, definitely not enough to, detract from normal life and, being available for my kids and, spending time with my family. That stuff goes into the weekend. But yeah, I just squeeze it in somehow. I don't know, Laurence.
I want to ask, a lot of graduates at some point start to contemplate practice ownership, or is that something that's crossed your mind?
Yeah, of course. I think it crosses, everybody's mind, and it's something that you contemplate quite, seriously. The thing for me, I don't know if you've figured out by now. I'm at heart, I'm a clinician. I'm a dentist, and practice ownership is something that can never be. The business of dentistry can never be separated from the practice of dentistry. You need a business to exist to be able to practice dentistry in it. So if the question of practice ownership ever comes up came up or will come up in the future, for me, it will always be to service the clinical dentistry. That's where the true love lives, I guess.
Mm-hmm. Of all the CPDs that you've done, which would you say was the game changer for you, and why?
Close to 10 years ago, I did a course with Tony Sirachi from Momentum. And I think for me, that was a bit of a turning point in terms of focusing me and encouraging me into do comprehensive dentistry, comprehensive treatment planning. Okay. And communication that goes with it. And also incorporating regular clinical photography into my practice, proper, with DSLR cameras. So that was a big one for me.
Was that because prior to that,
sorry, go on.
Sorry, I was going to say, was that because prior to that it wasn't something that you were seeing at the practices, or because the practice time or the way the practice was being run didn't facilitate that?
Yeah, exactly. There was that, but also I think, I just hadn't grown enough within myself as a dentist to be thinking in those ways. I was just like any other dentist. I was more of a recent graduate, and even though I had all these experiences under my belt, and I hadn't quite figured out how to do and present comprehensive dentistry for my patients. And I think that course, Tony was great. She really kind of made you question, well, when you look in somebody's mouth and you see all these things, do you diagnose all of them properly? Mm-hmm. Do you spend the time to? Do you then take the time to treatment plan them and to provide those options to the patients in an effective, non-threatening way, in a way that doesn't seem like selling? You're just giving them the options. And I don't know, I guess for me, I've been doing it so many years now, I can't not do it, and it seems common sense to me. But at the time, funnily enough, it didn't. And I think for a lot of people, it's not necessarily common sense until you're shown and taught how to do it.
Has there been anyone who's been pivotal in your career path, and why?
Back in the UK, when I was working in the hospital system there, in the restorative department, I had a Professor Martin Kelleher, or Mr. Martin Kelleher, and Martin is a consultant in restorative dentistry at King's College Hospital, and he's a fantastic guy. He's this big Irish guy, and quite gruff and blunt, and he can be quite abrasive with you. Very classic, and he shaped and formed a lot of my early years opinions and views. And what Martin's very big in, as anybody who knows him will tell you, is minimally interventive dentistry. Minimally interventive dentistry has a lot of different meanings, but in a nutshell, Martin talks about don't be destructive. Don't cause unnecessary damage. If you're doing anything, think about it, be ethical about it, do it for a good reason. And Martin's got a lot of publications, but one very influential publication, he calls it the daughter test. I don't know if you've come across this, you might have. Basically, he says, if you're about to offer a treatment to a patient or perform a treatment on a patient, ask yourself this question: would you do this same thing on your own daughter, or on your own mother or sister or brother or whatever? And if you ask that question from yourself and you hesitate, you then got to think about why you hesitated. What's that about? Martin's been very influential in a lot of ways in my dental career. And I've got a lot of respect for him and a lot of time for him. And I hope to see him again at some point in the UK.
Fair enough. That leads me to my next question, which is mentoring. You know, a lot of graduates want mentoring. What are your thoughts on recent graduates looking for mentoring?
I think mentoring is extremely important because when you come out of uni, quite frankly, you're a bit lost. You don't know, if you go into a practice, in a random place with nobody to help you or guide you anywhere, what do you do? What do you offer? It's a very big, scary world out there when you come out as graduates. So I think mentoring is very, very useful if you're lucky enough to get it in your early career, especially a good mentor who's willing to put the time and effort into helping you and teaching you. It's a difficult one because there's no definite clear pathway in Australia for this sort of thing. In the UK, like I said, when you first graduate, you have 1 year and now 2 years of sort of officialized mentoring, which is when you go into practice with a recognized mentor so that you can work into practice, but at the same time, somebody is there to help you and watch over you. And in fact, I think there's like a curriculum that runs through it. Those first couple of years, you meet up with other new graduates in your area and you have talks and lectures and, you talk to each other. So there's almost like support groups there. But yeah, as far as I understand it, in Australia, such a system doesn't exist. So it's a little bit by luck or good fortune that you can come across such mentors in your own practice.
Yeah, I would say that for some of our more recent graduates, they probably don't know, but there was a program before I graduated where they actually had the like a graduate program. But for whatever reason, that went for only a year or two, and then it just kind of fell through. And to your point, like I did hear about these from colleagues when I was doing the program in London. That you guys have in the UK a structured program where people, when they come out, do get that training, and it still continues. I didn't know it was going for 2 years now, but that sounds like a great program that I wish we could bring back.
Yeah, it is. It is. I know. I don't know why the one over here fell through. I didn't know that it had existed. It's a bit strange, isn't it? I think it's really needed. So hopefully at some point, something like that will come around again.
Yeah. I mean, look, all different graduates have different ways of looking at mentoring, right? Some people like to be held by the hand. Some people want to be checked in on once in a while. Some people want to be a fly on a wall and just learn by observing. How do you find yourself, learning, and how do you find when other people come to you and ask, hey, I want to observe you?
I really like teaching. So that's another, I guess you could call it a passion of mine. So I like doing dentistry, but I also really enjoy imparting knowledge as well. So back in the UK, before I came here, I was doing a clinical supervising in a final year dental students over there. And when I came to Australia, I did the same thing for 1 year at Westmead Hospital with the final year students. And then I moved a lot further away, so it was too far for me to drive to Westmead. But currently something that I miss. I miss doing. So now and again, various people reach out to me on Facebook and ask me questions and things. And I'm actually excited to answer back and to help them. I get a kick out of it. And I guess, and there's a few people that I guess you could call mentees. I've been very happy for them to come and observe me in my practice and watch what I do. And we've developed a relationship. They send cases and various things to me every now and again, and we go through them. And so it's something that I thoroughly enjoy. And I hope to, hopefully do something more with it at some point in the future. I don't know in what form exactly, but it's something that, I see it as, again, a part of myself.
Have there been any struggles in your CPD journey so far that some of our viewers might not know about?
Well, one thing I'd say is myself, I think this is something that a lot of dentists experience, having spoken to colleagues and friends. I think all of us, we work in such a stressful, fine manual job. We have strong internal critics. And I've got a very strong internal critic. And, this internal critic is a double-edged sword in that, as you grow and you develop more skills and you do better things to a high standard, this internal critic also gets stronger and stronger and stronger. And the good part of this critic is it strives you to improve and get better all the time. It doesn't let you rest and just be satisfied. The bad side of it is it can be brutal. And anytime you do anything and you look at it and no matter how well you've done it, you will see faults, you will see problems, you will beat yourself up about it. And you will go home and it'll be on your mind and you will go to bed and you will think about it anytime that something's not perfect. So it's a difficult one because I value my internal critic because it's been hugely responsible for getting me to where I am because I want to strive to improve. But at the same time, you've got to tame it, I guess to some point. You keep hearing from young dentists posting on Facebook experiencing this sort of thing about how they struggle with this feeling of dentistry is a hard job, and you hear about some people struggling with dentistry in general, and your heart goes out to them because you think, yeah, I know exactly what you're talking about, and this is something that I felt in the past, and I'm still feeling it. And I think that's a part of thing that probably people don't see. People talk to me and they think I've got it all sorted out and I'm confident and I'm doing all great stuff. Well, actually, no, there are some days that I don't feel that way. There are some days that I look at something that I've done and I think I could have done better. And inside of my head, that internal critic is beating me up. And I think probably everybody feels that, but not everybody talks about it or admits it. So I think it's an important thing to bring up and talk about sometimes.
So then how do you cope? I mean, look, you've done the case, you've taken the photo, you look at it and you're like, you're not 100% about it and you're beating yourself over it. But how do you kind of overcome that? Or how would you suggest, tackling it?
I think you've got to go very logical, very objective. Put the emotion aside and force yourself to be objective about what you're looking at and see this problem that I'm looking at, how much does it actually matter? Long term, is it going to have an effect on the longevity of what I've done, on the success rate? If yes, then I will try to fix it. If no, and I'm just being a super pedantic dentist and, focusing on something that nobody else will ever see, the patient won't ever know about, and has no actual bearing on the success or the longevity of what I've done, then I'm kind of like, you know what, Bez, you did your best. Sure, you can see this little blemish, part of the tooth that nobody else can see. How do you fix that for next time? So take a lesson from it. So plan for the future on how to fix what you're unhappy about. So it's that constant striving to learn from your mistakes, but also objective, so that you're not beating yourself up unfairly over things that may not actually matter that much.
I want to ask as well is that some graduates, they find a practice and they're just not happy with it. How would you suggest to them in terms of what they should be looking for, or how to determine this practice suits me and I'm happy to stay here?
In Australia, I know a lot of people that kind of like they graduated, they kind of went to one practice and they've been there ever since for the past 10, 15, 20 years. And it's been a great practice for them. It's incredible. How did you do that? I think the vast majority of people don't get that. And I certainly didn't have that. Obviously I was in the UK and I did various things and I came to Australia, but ever since I came to Australia, I've worked at quite a few different practices. And that's because for me, they weren't suitable for various reasons. I couldn't grow to be the kind of dentist that I wanted to be. So the answer to your question is very difficult. What do you do? I think you've got to look at what the problem is and what you're unhappy about. Some things, I guess this is another whole chat about this sort of thing. Some things could be deal breakers. I've been in practices where I've had complete deal breakers. I was like, no, I can't live with this. In which case you leave, you go to another practice. Other times you might have to make compromises. There are things that you're not happy with, but what things are you happy with? Can you live with it? Can you be there and make your living, and at the same time improve and gain clinical experience, and maybe at some point in the future, if things weren't right and you've gained your experience, then move on to somewhere else. So I think there's no blanket rule to this. You got to really look at each situation and think about whether or not the things you're not happy with you can live with or not, and whether there are any deal breakers in that equation.
So I want to flip it a little bit. So what's your current clinical day look like? The type of procedures you get up to?
It's a big mix. So I have, really everything in there. I think the better question is, what does my typical week look like? So there's checkups and cleans. There's normal fillings. There's crowns, bridges. There's CEREC. There's a fair bit of Invisalign. Here and there's surgical extractions. There's here and there are implant placements. Randomly dotted here and there are root canal treatments. It's a typical general dentistry day. There are cosmetic stuff, I forgot to say that. So yeah, there's composite, porcelain veneers, injectable technique, the sausage technique. A lot of those follow on from treating patients with Invisalign. So that's what I was saying. You kind of plan them together. Once you've done your Invisalign and you get to the end, that's when you come on to finish off the treatment and get that nice end result by getting the teeth to look good. But a typical general dental day.
Can you share with us what you hope your ideal clinical day or non-clinical day might look like in 5 years' time, and how do you want to get there?
Honestly, I don't think it'd be all that different. Not the composition of it, because like I said, I enjoy everything. If I was to say what things I really enjoyed that, maybe I'd increase the proportion that I'm even doing. Cosmetic stuff, particularly, I really enjoy the hands-on aspect of doing composite veneers, those kind of things. I find the artistic aspect supremely satisfying. So they're always a highlight when they come up. So there you go. More implants, more Invisalign. But really, still a mix of everything. I wouldn't cut anything out.
Yeah. I was hoping that you would talk about the 3D, just, milling more.
I guess that depends on where 3D printing technology goes. At the moment, it's not quite there yet to, you know, actually make definitive restorations with. You know, some people say it is, but most people think it's not quite there yet. But look, yeah, definitely 3D printing, I think, is the future of dentistry. Every practice is going to have it at some point in the next 5 to 10 years. We'll see where we get to.
Yeah. Could you share some more words of wisdom to your younger self, and what would it be?
Keep doing what you're doing. You're on the right track, I think. And probably, if I could go back in time, I'd do communication courses earlier, in the first couple of years since graduating. I think they're very, very important, and really something that every modern dentist you need to have in your skill set.
Well, Dr. Bez Shokouhi, thank you for coming on the show today. If you could let the people know how they can find you.
Sure. So I'm on Facebook. I've got a page on there, Dentistry by Dr. Bez Shokouhi. I'm also on Instagram, dr.bez.shokouhi. So on a fairly regular basis, I post cases on Facebook and Instagram, some interesting stuff. The Facebook one tends to be more step-by-step stuff. The Instagram, more just visual things. So reach out. Anybody wants to talk to me, happy to have a chat. Again, like I said, I quite enjoy the mentoring aspect and helping out anybody who'd like some inspiration.
We'll definitely leave in the show notes below. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. And we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Thanks very much, Lawrence. It's been a lot of fun. Thanks very much.